Federal government hands over COVID-19 response to states. Now, this is causing some people to panic a little bit. This is no reason to panic. It is actually the right course of action. Now, we're going to be going into why this is the thing that the federal government is trying to do at this moment, why the NCDC is saying this, and what is really going to be happening. What do we expect as this thing goes on? Now, this is actually something that the PTF chairman, that's Boss Mustafa, said, and he made it very clear that the reason why they're going to be doing that is because we now have a sustained community transmission of COVID-19 in Nigeria. That means that the thing is able to spread within the community. It's not always what you have always heard about, that okay, it is coming from another state, is because of maybe interstate travel or anything like that. It is a sustained transmission within each area that we have the disease now. So let's say we have the disease in a particular local government in Lagos State. You don't need to have somebody bringing it from outside. It is able to keep propagating itself within that area in Lagos State. So that's what it means. So the only way to be able to deal with this thing effectively when it has gotten to that nature, it has gotten to that extent, is for the local government people, that is the people actually in charge of that area, who know what is going on, who know what is peculiar to their own areas, who know the situation that is actually happening in their own area, to be able to do or to take over the response to the thing. Of course, the federal government is still going to be giving some sort of assistance to it. It's still going to be helping them out if there's need for any sort of federal intervention. But for the most part, the people in charge, the people closest to the people that are affected by this, should be the ones in charge of the situation, so that the response can be effective enough. You can't be depending on the NCDC over there in Abuja to help you out at your own community over at some place over in the north or something like that. So that's not what you want. You want people who can respond in actual very, very fast time to what is going on in that area. So that's what is going to be happening. And of course, this is something to be happy about in Nigeria, that we always talk about how the country is not very federal in the actual sense of it. That is, we're not a true federal state. But if you actually look at it, it's a good thing that the federal government is handing over responsibility to the states when it comes to something this serious. Exactly that is what is going on in the United States too. Trump is handling all those things over to the state governments. So he has already ordered that there should be a reopening of the economy, but he still said that this thing should be done by the discretion of the state government, the state governors themselves. So it's a very good thing that we're having a little bit like a modicum of federalism in Nigeria at this period, and it's a very, very good thing anyway. But also, one of the things that we also have to understand is that there is going to be a spike in cases. That's also one thing that Boss Mustafa said. There's going to be a spike in cases as Nigeria keeps reopening. That's just what is going to happen. Now, I'm very surprised that all those people who feel shocked that there's going to be an increase in the cases of COVID-19 around the nation, especially outside the country, they suddenly feel surprised that why do we have an increase after we opened up? I mean, that's the basic reason why we went for a lockdown. If the lockdown would not prevent increase in cases, then we shouldn't have gone for lockdown. Actually, going for lockdown is not about just keeping the numbers down. It's about keeping the numbers down enough so that it does not overwhelm the healthcare system. Now we have not overwhelmed our healthcare system and the economy is getting destroyed. That's why we need to do what? Keep opening up the economy gradually, so that every single person, of course with sense, of course with wisdom, to open it up with wisdom and with information, with data, so that we don't just take irrational decisions. So that's exactly what is going on. So now we need to be able to expect that there's going to be an increase in the number of cases. Again, that's why I've been saying that we need to isolate those people who are very vulnerable. There will be a spike in cases, but it is something that we are going to be willing to endure. That's just it. There's going to be a spike in cases, but if most of those people who get a spike in the infection rate are those that are young and have no sort of pre-existing conditions, we are not going to be having a significant spike in the number of deaths that would follow. everything is going to look almost normal. Of course, you're still going to be able to practice all the things you need, like social distancing and all of those things. You still have to keep doing them. No matter how much everything has been opened, you still use your mask, still wash your hands, still use hand sanitizers. This thing has not gone away. We just don't have any way to lock down internally, like eternally, forever. That's why we have to open up. So if it's just about protecting lives, we will all just lock down. But there's no way to do it, because this thing is not like, it's almost like a false binary when you say that it is either you are saving lives or you are saving money. This is not a false, it's not something that is a binary option. It's something that, if the economy collapses completely, it's going to actually affect life. It's going to cost people their lives. That's what is going to happen. People are going to start abusing drugs. People are going to die from drug overdose. People are going to die from all sorts of things like that. Lives of children will be ruined. All sorts of things are going to happen that you can't see directly right now, because you're seeing people dying from the coronavirus. A whole lot of things would come after that if the economy completely collapses. That's exactly what is going to be there. Consider what is going to happen to a family where the chief breadwinner loses his job and there's nothing for them to do, and then they become completely destitute. What do you think is going to happen to the family? What do you think is going to happen to the lives of those children, having a very horrible life at their age? So that's exactly one thing you have to consider. So it's actually a balancing act, like I have always been saying. And of course, we also have to remember that there have been studies in the United States that conducted by the United States CDC. We have our own as NCDC here, but their own is just the Center for Disease Control over in the United States. And their studies show that death rate of COVID-19 is actually 0.4%. That's about 4 people dying in 1,000. So that's a very significantly low death rate. Like very, very significantly low chances of you dying from COVID-19. Now, you might get it, but the chances of you dying from it is significantly low. And this 0.4% has actually factored in those people with serious health issues. So even if you have serious health issues, you still have about very, very, very low chances of dying from this thing. So it's not as dangerous as we've always thought about it. Some people were thinking that it's going to be about 10% death rate before, but that's not what it is, because so many of those people who have the disease don't even have any sort of symptoms. Again, that's the reason why you have so many of those people who have been isolated in isolation centers running away from the isolation centers, because they feel like they are healthy. They feel like nothing is wrong with them. They feel like they are being arrested or they are being detained unjustly and unfairly. So they decide to do what? To run away, because it's like, okay, what if nothing is wrong with me? And then you put me together with all these sick people. What if I then get sick from this and then die from that? So that's the reason why all those people are running away. The reason is because most people, about 80% of people who get the virus, don't even have any sort of symptom, not even so much as a sniffle, not even so much as a sneeze. They will not have any sort of symptom. It's only the 20% that remains that will require medical attention. Only those 20%. And even out of those 20%, it's only about half of those 20% that we really, really need to be using ventilators and all of those things like that. So it's not as dangerous as we've always thought it would be. So it's not that dangerous. And it means that we can basically open up the economy. That's why basically every single country around the world is doing that now. We are not the odd one out. We are basically in the middle of the pack. We are basically doing what everyone is doing. Every single nation around the world is doing that, and it's the best thing for us to do to save as many lives as possible. It's a public policy sort of decision. You have to balance things, and this is what we have to just go with in Nigeria. Anyway, thank you very much, everyone. I'll be seeing you guys in the next video. There's always going to be new videos every single day up on the channel. Make sure you subscribe for that, and follow us on Instagram and on Facebook, Naija Unsealed. Bye.